Hi, my name is Jillian Geiger, and today I'm going to be demonstrating setting up a sterile field and sterile gloving. For the purposes of this demonstration, I will not have a wound or a simulated patient in front of me because I will just be setting up the sterile field and donning my sterile gloves as if there were a patient and I was cleaning a wound. If there was a patient, if this was in the clinical setting, I would knock on the door, do my hand hygiene, whether that's the hand sanitizer on the wall or the sink in the patient's room. I would introduce myself and verify the patient's name and date of birth, as well as checking their orientation to person, place, time, and purpose, assessing for any pain, and kind of looking at the outside of the wound dressing, the old wound dressing that's already there. And then I would set up my table. If I touched anything, if my hands were contaminated or dirtied in any way, I would perform hand hygiene again, whether that would be hand sanitizer or the sink. It's just according to agency policy. Well, the sink with soap, hand washing. And then I would take the dressing change tray, the unopened dressing change tray. I would open it, peel it back, and take out the sheet, only touching the 1-inch border and being careful not to fluff it. Just kind of letting it lay down on its own when it catches the air. And then I would take the dressing change tray without touching the inside of it, touching the 1-inch border around it or the bottom of it, and dumping it out. Being careful to not touch any of the contents that are sterile other than the sterile glove package. This dressing change tray did not have a sterile glove package, just had the 2 separate sterile gloves. If there was a package, I would just find the package, set it down, and open it and orient myself to the gloves. And then I would take one glove touching the inside because the inside is non-sterile. I'm gonna orient my hand and insert. And then I'm going to take the other glove, picking it up underneath the cuff because the outside is sterile, and putting it on, and then fixing them if they needed to be fixed, ensuring they fit good without falling off. And then I can touch any contents from inside. I can touch the wound, being careful to only have one hand non-sterile at most. If they were to both become non-sterile, then I would remove the gloves just like this, going underneath the cuff, and then discarding of them of the trash receptacle, and then I would always ensure that I have a second package of sterile gloves handy. Again, these are not in a package, but then I would put these on, grabbing the cuff, orienting myself, and putting them on. Only touching the inside. And then I will fix it whenever I get the other glove on because there was a problem. But then I'm going to grab the cuff again, orient myself. The fingers are slightly crinkled, so it does make it more difficult, but I can fix it now that both of my gloves are on. I just have to make sure that I'm only touching the outside of the glove. It is best to make sure that you don't have to do a lot of readjusting, but if you do, it's okay. And also it can be difficult if your hands are sweaty, things like that. Only touching the outside of the glove, just like that. And then you remove them just like you remove the other ones, and you can continue your wound cleaning.